I can play the drums in this as well.
Oh, yeah.
Hi, I'm Dr. Dinesh. I'm based at the KTPH Sports and Exercise Medicine Centre, and I'm here to say yes to health. One of the challenges is if you haven't exercised for a while and you don't know where to start. So sometimes speaking to somebody who's got experience in exercise and finding out different ideas as to what might be interesting to you and then taking that up. Another concern that a lot of people have is, am I fit enough to do this? And so our general advice is to start off small and take baby steps until you get to a place where you're quite comfortable. So having a rounded approach to exercise is important, but really finding something that's of interest to you, or that will keep you motivated and keep you coming back to it, that's just as important. Frozen shoulder typically happens in patients who are female, around their 50s, and in patients with diabetes and thyroid disease. Frozen shoulder can also happen if you've had a trauma to the shoulder. So one of the things that we advocate here is doing exercise, so with a physiotherapist to improve the range of movement and so on. There are particular types of injection that we do to help with pain and also to help with the movement. And so combining these two, we can try and improve the recovery process or reduce the time that you're affected by it and try and avoid some of the long-term disability that you might experience with it otherwise. Well, there's a big difference between pain and feeling the burn from the exercise. Pain is not an ideal symptom to have. It's usually the body saying, hey, there's something wrong somewhere. And either we have to address the technique, the load that we're putting through it, maybe we're not giving ourselves enough recovery time, stretching or conditioning and so on. So if you've been to the gym and you've done some exercise, maybe you haven't done it for a while, you kind of feel a bit achy the next day and you feel you're walking around like you're a bit of a mummy and so on, and that's normal. If you start having significant pain, particularly if it's localized to a particular area, if you interpret that pain as having had a good workout and you keep doing whatever you were doing, the likelihood of developing a more significant injury is much higher. Whereas if you recognize that pain is pain and look at what you're doing and how you can maybe perhaps avoid it and limit it, then you can try and avoid injury and everything in the future. For the most of us, it's a balance between input and output. One of the tendencies when we exercise is that we feel more hungry. If you want to lose weight, basically what you need to do is actually reduce the calories at the same time as you're exercising. Now everyone's going to be, whoa, that's like crazy, man. How are you I'm going to be so hungry all the time. And unfortunately, if you want to be in that negative energy balance, that's where you need to be going. Otherwise, what you're basically doing is you're maintaining your weight as opposed to reducing your weight.